So we surveyed the literature on this a year or two ago, and the really interesting ones I think are air pollution. I think also vitamin D, and which is related to sunlight, is a very important one. And there was a Mendelian randomization study recently which I think convincingly showed that there seems to be a causal link between lower levels of vitamin D and dementia. There's literature linking a number of other environmental risk factors. One famous and slightly controversial one is aluminium, but I think the evidence linking aluminium levels in drinking water is convincing as a risk factor for Alzheimer's disease. And even in Scotland, where the levels of aluminium are very low, there still seems to be a dose-response association between higher levels of aluminium and increased risk of dementia. And then there are some slightly more unusual ones like exposure to magnetic and electric fields, which is more difficult to think about what the mechanism might be there, but there's epidemiological evidence linking it to Alzheimer's disease. I think the broad point is that it's important to think about a broad variety of potentially modifiable risk factors. We're well aware of cardiovascular disease risk and educational attainment and socioeconomic status and these sorts of things, but there's still a good amount of dementia risk that remains unexplained. And I think environmental risk factors could explain part of it. And so thinking broadly about research is what we should be doing, because this is an important field we work in, and we need to pull out all the stops to try and do what we can to help people with dementia and people who may be at risk of developing dementia in the future.